We've been watching the new coronavirus outbreak in China for some time, as soon as the first news came out. And we've actually been preparing for a situation like this ever since we had SARS in 2003, 17 years ago. And we built up our institutions, our plans, our facilities, our stockpiles, our people, our training, because we knew that one day something like that would happen again. So when this thing came about, in a way it's a shock, but it's not a surprise. And I was away when we set up the committee to respond as the situation heated up. I was away in Davos. But when I came back and I had a chance, I wanted to come and visit to see what our preparations, our facilities, our organizations, and most of all the people, the teams who are working day and night, looking after patients, screening the suspect cases, tracking the public health, the new visitors coming in, and making sure that we have a coordinated national response to this new coronavirus, which has become a very serious problem in China, and as the WHO has recognized, is an international medical emergency. So far, we've done well in terms of catching the cases which have come in, isolating them, treating them, and some of them are here in the NCID. And the doctors tell me that the patients are generally doing well, which is good news. But we have to continue to be vigilant, because the outbreak is far from over. In fact, it may still be accelerating in China. We don't know what is going to happen in other countries. It's spread to many other countries. No other country has got a huge number of cases like China so far. But you don't know how the countries will be able to react, detect, contain, and if you have it can become a major problem for the world, and not just for a short while, but for quite a long time to come. So we have to continue to be on guard. I think that the government has got our plans together. I think we have very professional, dedicated medical and public health teams. I think that the public is very aware of the situation. We have this gov.sg WhatsApp chat group, and more than, I think, 250,000 people have signed up for the information which we're putting out on the chat group. So we're doing everything that we can. I think there's every reason to be watchful, but there's also every reason to be confident. And for each one of us to do our part, to be sensible, first on personal hygiene, wash your hands frequently, don't touch your face and mouth and eyes unnecessarily, because that's how germs get from your hands into your body. If you are unwell, stay away from work and crowds, stay at home. If you are well, go about your life as normal. You don't need a mask to go around Singapore or to be at work if you are well, because there's no community spread of the virus. And the mask gives you a false sense of security, because most of the time you don't get the virus from breathing it in. You get it from contact, and you need to take the rest of the precautions to wash your hands, to keep yourself clean, and to know when you are unwell and to stay away from crowds. So I'm very happy with what I saw this morning. I met a few of the staff to thank them personally, but there are more than 1,000 who are working in NCID, and people working all over at the entry points, the ICA staff, at the other hospitals, and all over the ministries and the SAF and the PA, who are going to be distributing the masks this weekend. I think if we work together, we can overcome this challenge. I have every confidence of that.
PM, given that this is now a global health emergency, does this change anything about Singapore's approach?
We have been taking it very seriously all along, but it's a dynamic situation, and we are watching the developments and the assessments. And this assessment by the WHO yesterday confirms our view of the situation. And the ministers are evaluating what we should do next. And I think they'll have some announcements to make later today.
The anti-Chinese sentiment is quite high in overseas. So what are your message to Singaporeans in
I read an article in the International New York Times yesterday which says that in many countries people see this as a Chinese thing and have a reaction against China and PRC Chinese particularly because they think they are the cause of the virus. And I think that's not quite the right approach to take. This is an illness. I don't think the Chinese wished it upon themselves. They are trying very hard to fight it, and I think we should work with them to help make sure this is not a global problem. We have to protect ourselves, but you have to be quite clear that this is a virus which is not a virus which only carried by people who come from China. It's a virus which can affect any human being, and I think we should have that firmly in mind.
What measures do we have in place in case of community spread of the virus?
I think we are not anywhere near that point. We'll do our best to make sure we prevent community spread. If we are vigilant, if people come forward when they are unwell and we can identify their cases and isolate them, I think that we are a long way from having a community spread. But I would also say that this is a virus which is it has similarities to SARS, is related to the SARS virus, but it behaves differently from the SARS virus. It's probably more infectious. It's possibly infectious earlier, even before people have symptoms. But on the other hand, if you look at the data coming out from China, and even the cases we have here, it's not as lethal as the SARS virus. The death rate is much lower, and in China, they are reporting that maybe about 20% of the cases they see become seriously ill. And the rest, some of them, we call it Wuhan pneumonia, but some of the cases, about half, don't even have pneumonia. They have the virus, they have an infection, but they don't have pneumonia. So it's an illness which we are still trying to get the shape of. I don't think we need to panic.
What is the government doing to mitigate the economic impact of the travel restrictions on the tourism industry?
It's going to hurt us. China is a very big source of tourists for Singapore. I think we have 3 million something tourists come from China in normal years. With this, that's going to be, that's tailed off already considerably. And I think tourism from other sources will also tail off because everybody will be cautious and will stay at home and avoid travel. So I think the travel, F&B, hotel industry is bound to be significantly affected. I expect the rest of the economy also to be affected because with China in semi-lockdown mode now, their economy is bound to slow down, and our economy is quite tightly engaged with theirs. They are our biggest trading partner. So we are working hard, MTI and the other agencies, on suitable measures to help businesses and help Singaporeans and help the economy see through this crisis period.
Yeah, how can Singapore enhance its measures to counter the spread of untruths about the virus?
Well, I'm very glad that we have POFMA because this is one difference between this round and SARS in 2003. During SARS, we did not have the social media. This round, you have the social media, you have WhatsApp, and all sorts of stuff circulating around. Some rumors because people are scared and they hear something, it gets transmitted, it gets distorted, becomes untrue, you're not sure, but it's very scary. You tell your family and friends, and then it goes around. Some of it we know is malicious and deliberate. So people who are making up stories, people who are deliberately fomenting FUD, fear, uncertainty, and doubt. And we've acted promptly with them, against them, using POFMA. And we are very diligent in putting out information as quickly as we get it and as quickly as we can verify it in order to make sure that people know what it is what is the truth, and what you need to worry about and what you should ignore. So I think we've got many channels. I mean, the government is also on the social media. We are on the we are in the mass media, the mainstream media. All of you have a very important responsibility in this situation to explain to people what is happening, to report things which do happen, whether it's a favorable development or a new worrying change, and to make sure that people have sources of news which they can trust and which are reliable and which they will turn to. And I think that we have a good chance of succeeding in doing that.
How can we strike a balance between being well prepared versus perhaps overreacting to the current situation, for example, with the mask situation?
Well, I think as a government, in a way, we are overreacting because we are trying to look ahead to see what can go wrong and take preemptive steps to prevent that from happening. So if you see something didn't go wrong, it's not just hang on, I'm very happy it didn't happen, but it means we have done things which were right, and we are glad that it didn't have to be tested. But I think for individuals, you have to take the best advice on how best to protect yourself and what is the best thing for us to do collectively as a community in order that we come through this safely and well. We have enough masks in Singapore. We have not run out. There are plenty. But if everybody carries one, wears one every day, well or not well, and there are 6 million people in Singapore, every day I'll need 6 times 3 or 4 masks. And in that case, I will run out. But it is not, the doctors do not advise us all to wear masks walking around. It is not helpful. And in fact, it can be counterproductive because it may give you a false sense of security. You think you're safe, but in fact, your hands are dirty. Your mask may be dirty. When you take off your mask, you touch it. That's when you get infected, not when you wear your mask. So therefore, I think we all want to be careful, and we all want to protect our family and loved ones, and especially our children. And if you have elderly parents, they're vulnerable, their body's resistance is not as good, immunity is not as good. But I think we have to take the best advice as to how best we can do that. And I would go with the doctor's advice.
Earlier you interacted with the healthcare staff. Can
Yes.
you share your thoughts on their efforts?
I have a lot of respect for them. They took this job, they know it's a difficult job, and one which is not without risk. They've been through SARS before, some of them. Some are younger. This is, in a way, is the first time dealing with a situation like this, but they have been training for it consistently for their careers. And I think that the training, the know-how, the instincts, that the values they embody will see them through. So I thank them.